My name is Dr. John Palmer with Friends and Family Health Centers. Today I'm talking about Foundation 4 out of 5. So we're doing a series that actually is educating people on all 5 foundations. This is important because these 5 foundations is the reason why we get people better in our clinic. So the 4th foundation is movement. Most of your brain is dependent on you moving. So whenever you move, you literally light up your cerebellum, you light up your brain to the point to where blood flow increases, oxygenation increases. You literally turn your body on when you move. So if you are one of those people that say, oh, you know what, I move throughout my day, well, it doesn't really work like that. So what it does work like is you have to think about where we came from. So etiologically, or where we started from caveman, cavewoman. What did they do? They actually would go and hunt. They would actually increase their heart rate. So actually think about this. Think about hunting a rabbit and how hard it would be and what your physiology would do. Do you think you're going to be calm and sedentary? No, you're not. You're going to be moving around. You're going to be moving at a high rate for a short amount of time. This is the reason why high intensity interval training has worked really well for people, or Tabata, CrossFit. The reason CrossFit works, not because it's CrossFit, because of how they program the workouts. So you can do those things also to actually make your body healthier and happier. And so I want you to understand that it's not about truly like a six-pack or biceps or whatever that is. It's about blood flow. And so it's about functional muscle. It's about that functional muscle to actually hold your body upright and actually to move the best way as possible. So what I mean by that is if you go to lift something, you need to be able to lift it. If you go to lift your baby 50 times in one day, which a lot of moms do with one arm, or they hold a baby with one arm and they do other things. And so you have to have functional muscle. You have to do things that will actually get you from one point to another in whatever stage of life that you're in. And so you need to have a workout program that is centered around actually changing your physiology. So changing your heart rate, changing your respiration rate where you're having to catch your breath, and that what that is doing is delivering oxygen, glucose, and nutrients to your whole body. It's perfusing every single cell of your whole body with oxygen, glucose, and nutrients. So the really cool part about it is also when you deliver oxygen to your body, it's very hard for cancer to live in your body. It's very hard for any type of infection to actually win whenever you have a readily available oxygen, glucose, and nutrients. I'm being very general with these terms. So if you want to be specific, I have to do that on an individual basis. So the other part is when people do exercises, a lot of people think that they have to exercise for a really long period of time. And so one thing that I want to tell you is that's not true. And so one thing that you have to practice at the beginning, you have to make sure you move, you have to make sure you're able to do a squat, you're able to lift things overhead, you're able to rotate. So all of these things that mean you don't have to have weights to do them at first. So one of the reasons why people end up in our clinic is they try and do too many things at once and they end up injuring themselves. And then we're able to help them and they're able to get back to actually functioning the way that they were meant to function with our guidance. And so the whole point of exercise is to make sure you increase your heart rate, increase your respiration rate, you increase the delivery and availability of oxygen, glucose, and nutrients. You also need to be able to begin to build functional muscle. And that functional muscle needs to be, usually it means that you don't use machines at first. Machines being like a bicep curl or something that is on a cable. It needs to be like a free weight that you have to actually adapt to. And so what I mean by that is when you lift something, your brain has to engage and it has to use all of those sensors in your body to actually lift it effectively. If you actually are doing a bicep curl machine and you're only using that machine in a linear or a static fashion, it's not going to be as effective as if you were to use a free weight or you were to do a squat. So I could get a lot more in depth into this. In the future, we're going to have videos on doing certain movements, but one thing I want you to understand, your brain controls everything in your whole body, but it is dependent on movement. It is dependent on the movement of that second foundation that we talked about, movement of the spine, the position of the spine, so you can move optimally. You need to make sure that the fuel is there, so when you do go to increase your heart rate, increase respiration rate, you have clean fuel to actually do those things. You don't create inflammation. You create inflammation when you move without fuel. And then, so movement is so important to make the brain healthy. You have to do it daily. You have to make sure that you move on a daily basis. You have to roughly get about an hour of movement a day. You have to change your physiology. If you're injured, you have to see a professional to actually get you to a point to where you're not having symptomatology to where you can move. There's no reason in most states of the human body that you cannot do something to actually improve your movement throughout the day. That might mean for the elderly population, they need to go get in the pool. That might mean that they need to walk around their house. Any level of health that someone is in, you can actually challenge that level of health. Think about what exercise is. It's truly, you're requesting your body to adapt in a stressful situation. So you're essentially priming your body to actually adapt, and you're being proactive in saying, hey body, we have to adapt in these stressful situations. So when you do have a bad day, what's going to happen? You're actually going to be able to decrease that stress. You're going to absorb it a lot more efficiently. You're not going to get as stressed out. Your body's not going to release those hormones and those chemicals in your body that creates inflammation on a chronic basis. So what you're doing is when you exercise is that you actually are priming your body to adapt to a stressful situation. That's what life is. You're strengthening your heart. You're strengthening all of your organs. You're strengthening your brain. You're strengthening your body's ability to truly change in the moment and then change back to a normal stabilization state whenever you stop working out. So that's why it's important to do it on a daily basis. Don't be reactive. If you're reactive, that's how disease happens. When disease happens, unfortunately, that's when we die. And so if you practice, you work out, you practice that stressful situation, and that's how you get better at adapting. That's how you stay healthier. Truly, stronger people are harder to kill. And so what I mean by that is, I don't mean that being funny, is it's true. If you can adapt more easily, then you're able to adapt, you're able to live longer, you're able to have a more fruitful life, you're able to have the best chance at living the life that you want to live. My name is Dr. John Palmer. Thank you for listening, and hopefully I taught you at least one thing. Check out our blog post, check out our website. It's a lot of other content there if you want to learn more.